He's been, like I said, my miracle baby. And then 4 years later, he kicked me in the boob. And I ended up at the hospital.
Hello, and welcome back to your favorite show, DocTalk, where we talk to a doc about all things in the news, talking to a doc about what you want to talk to a doc about. And today, we have a very special guest, our fellow Progyny family member, Laura Perez. Laura is here to talk about such an important topic that is timely and also in the news, Breast Cancer Awareness Month. And Laura's offered to share her own story, and so we should have had tissues here on the table. Breast cancer is the most common cancer globally, with 2.3 million new cases every year. The American Cancer Society recently released a report that the prevalence of breast cancer is on the rise, and especially in younger populations. We're going to talk about women with breast cancer. We know that men also have breast cancer, and we know that not everyone who is born with ovaries identifies as a female, but we're going to use a placeholder for women here today. And the U.S. Preventive Services Task Force has urged women to get mammogram screening earlier, starting at age 40, whereas a previous recommendation was to start this at age 50. A recent survey said that nearly 50% of women skip important preventative care appointments. And so this is me and a doctor and Laura all saying, go to your annual well people visits, get your mammograms if you're over 40, talk to your OBGYN or other healthcare providers about your risk and about maybe how your family history may affect when you're recommended to have those initial screenings. So we'll jump right in. Laura and I have known each other for almost 7 years. We work really closely together at Progyny. She manages a couple teams, including some of our claims and pharmacy folks, and so work really closely as her team takes care of members. As much as you want to share, talk about your breast cancer journey.
It's been an interesting one. I had my mammogram at 40. Everything was fine. Have been going every year for the past 3 years, two years. Mm-hmm. Negative. January, come September, my son, who's 5 years old, 4.5 actually, right now, but at the time he was jumping on the bed and he hit me in the boob. And I said, oh wow, that hurts. I don't know what happened. A couple of days later, decided, you know what, it keeps hurting. Why is it still hurting me? And I decided to do a self-exam in the bathroom, which really didn't do, which wasn't common for me to do, but I decided to do it that day. And as I went, I squeezed my nipple, and discharge came out, and that's when it freaked me out. I called my GYN immediately. She said, come on in. May not be anything. But I haven't breastfed in 2.5 years, so she was like, I don't know, that kind of feels weird. Went in the next day, thankfully. She said, you know what, I don't feel anything, but no harm, no foul. Let's go get for a diagnostic mammo, and I'll put you in right away. I said, okay. I went in, didn't think anything of it at that point either. They came back at that point in time and said, you need a biopsy. Something's up. Got the biopsy, got the results, stage 1 breast cancer. And that was the scariest thing, I think, for me to hear. Everything just flashes through your eyes, and you kind of don't know what to do, what to think, where to go. And at that point in time, thankfully, I had friends, 2 of them that are right here, actually right next to me, because you guys helped me a lot. Lissa was my second phone call because my husband did not pick up the phone. Typical. And she made a phone call to Dr. Choi. And Dr. Choi at that point had just started, I think recently at Progyny, and said, I think I know somebody who can help you. And she made a phone call. And because of both of them, I'm here today for many reasons, because you guys helped me. Given a year later, I'm here. I'm in remission, and we'll talk about that. But I do want to say thank you to both of you guys.
Where are the tissues?
Seriously.
Seriously? I'm just kidding.
This was I was not prepared for this.
Sorry. I went off script. I told you.
That's fantastic. You have to keep everything in. But I mean, yeah.
Yes.
Right. We're so grateful you're here.
Love
too.
you. Progyny is really one big happy, I was going to say crazy, you heard me, but one big happy family. And so I know if it were me in that position, you would have done exactly the same thing. And so I'm so glad that we both could be there for you.
Yeah, it was, I thank every day that I have an amazing family, friends, colleagues that are family in some sense, because if it wasn't for you guys, not just you guys, but like my staff, external people from different departments would reach out and just to, how are you? Are you okay? And I think that was so meaningful. Yeah. And it made me feel so comfortable to know that I'm working for a place that cares. And I think that was so impactful for my recovery, because I did not stop working. I worked every single day during my whole breast cancer journey. Only took off when needed.
We said, please take off, please take a break. And
I wouldn't.
Laura said, no, I need the work, I need the structure, I need the schedule. Yeah.
And we're actually grateful that her son kicked her in the boob.
Yes.
Right? I mean, when do you get to say that?
It started off from freezing my eggs at 37 years old. I did that at that point in time because I didn't know where I was going. If I was ever going to be a mother, if I was ever going to get married, if I had a boyfriend at the time, but was that next step going to happen? And I decided to freeze my eggs. And it was a great experience. I had incredible people at Progyny and also my doctor who decided, she knew exactly my protocol and she knew exactly what I was trying to achieve. And come to find out, that was March. And in July, my boyfriend decided to propose. So that kind of started that. And then a year later, we decided, let's try. Let's try to have a child. He has some complications. And then obviously with my age, I decided, I have these eggs. Let me thaw them. Let me see if we can create embryos. And it ended up being 3 embryos that was created. And 1 that was actually after PGTA testing, 1 that was successful, which is my son.
And then you had a transfer.
I had a transfer.
Had Caden, and he's
4 and a half. Going to be 5 in
Yep.
November. He's been, like I said, my miracle baby. And then 4 years later, he kicked me in the boob. And I ended up at the hospital.
So that's a question that I had to ask you about. I know that when you were diagnosed with cancer, your family was already complete. You and your husband had your son, and that you knew that was your family was complete. But did your oncologist talk to you about fertility preservation?
Yes. Thankfully, my doctor's a young doctor, and she deals with women within the ages of 35 to 50 in her oncology practice. And that was one of the questions that she asked me.
Good.
Funny is that she was like, well, if you are planning on having more kids, I know of a company called Progyny. I started laughing. I was like, yep,
me too.
So do I. But that was actually a very serious question, something that she had asked my husband and I in the chair of if you are not if you're not done with your family, we need to have a different conversation immediately before we take next steps.
Yep.
My husband and I at the room decided, you know what, we're done. We didn't think we were done, but at that point in time, my health was priority, and I felt that I needed to take care of what I needed to take care of at the time, and I was done. And I was blessed to have my one, and I'm grateful to have my one.
Can you talk, Dr. Choi, a little bit about why Laura's oncologist would need to raise fertility preservation and why for women who have been diagnosed with cancer, and men for that matter, but for someone who's been diagnosed with cancer, why fertility preservation comes into the conversation?
Yeah, it's a great comment and question. I'm so glad that Laura's oncologist actually brought this up because I think, 10, 15 years ago, that wasn't really the standard conversation that most oncologists would have with their patients. They're so focused on trying to save their life from the cancer that they have. And the reason why I think it's important to have this conversation, even if you make the decision like Laura, I'm done, no need to talk about fertility preservation, let's just move on with a cancer treatment plan, is that a lot of the life-saving treatments, whether it's radiation, chemotherapy, sometimes surgery, for certain cancers you have to remove, ovarian tissue, testicular tissue. And so I think it's very important that focusing the treatment plan not just on surviving, but giving person hope by looking into the future beyond the survival. And so the patients I've helped take care of over the years, and actually Alyssa and I actually worked together previously in a past life where we actually helped develop an oncofertility program. And we found time and time again was that for these oftentimes young, newly diagnosed women with breast cancer, that was a very common issue, or lymphoma, you feel like your life has just exploded in front of your eyes with this diagnosis. And the one thing that kind of gives you a sense of control and hope that you're going to get through this and live into the future is having the discussion, having the opportunity to preserve your fertility, whether it's through for women. We're single, we typically recommend egg freezing, or in partnered situations that are really solid partnership. And, we discuss options, embryo freezing for fertility preservation, and for male patients or those born with sperm freezing. Those are all three very great, opportunities for fertility preservation.
Yep.
Yeah.
And for those who have the Progyny benefit, that's covered under your Progyny benefit. For increasingly, coverage is expanding, especially for oncofertility or fertility.
Thanks to the Chick Mission, right?
Yeah,
right,
the Chick
because
Mission.
Amanda Rice,
Yeah.
She's like one of my heroes.
Yeah.
She's,
Did you know Amanda gave Laura a bracelet?
Oh, that's amazing.
Isn't that great? Hi, Amanda.
That's hi.
Still wearing it.
So for those of you who don't have coverage and find that you can't foot the bill, for oftentimes it can run $10,000, $15,000 or more for the medications and the treatment to freeze your eggs or embryos. There are organizations like the Chick Mission, and their founder actually is a 3-time breast cancer survivor, right, Amanda Rice, and they might be able to help you with funding through grants.
Yep,
right?
That's right. And so fertility preservation is important because you said chemotherapy, radiation, and sometimes surgical interventions can affect future fertility.
And time, because oftentimes,
time.
Especially with breast cancer survivors, your oncologist might say, all right, once we get you on the treatment track, we don't want you coming off the medications. Oftentimes it's like tamoxifen or letrozole or other things.
Yes.
And we don't want you trying anything else in terms of trying to conceive for at least 5 years post remission. And so, as we've had discussions, I think for us, it's like common sense, but a lot of people don't realize, especially for women, because you're born with a fixed number of eggs, that number goes down with aging. That doesn't necessarily translate into infertility, but the longer you wait, that increases your odds that you might have future infertility issues. So to try to ward against that, another reason to think about fertility preservation.
Yep.
Right.
And Laura talked about she was diagnosed with stage 1. You did end up needing to have chemotherapy. You want to talk a little bit about your treatment?
So they were very nervous of it reoccurring. So they didn't think that just with surgical and a 5-year kind of tamoxifen plan was going to work. So they decided that it was best for me to have chemotherapy and radiation. That, thankfully, was a decision that the doctor gave me. She didn't automatically tell me, yes, you should do this. She actually gave me the choice. I think that was very important because I asked the right questions. I, went home. I did some research. I advocated for myself. And then I went back and I said, okay, I'm going to do this because I want to live another 50 years. And regardless, was it scary? Yeah. Because I didn't want my son to see me sick. And first thing you think of cancer and you think of chemotherapy is you think, oh my God, I'm going to look sick. I'm going to lose my hair. I'm going to lose my eyebrows. I'm going to lose my identity. I'm going to lose who I am. And I was really scared. Thankfully, I have a great support system. My husband foremost, my family, my friends, colleagues, everybody who reached out, that they told me it was going to be okay. And I knew I was going to be okay after, the first one. After 4 successful sessions, I took a 1-month break, and I had 5 radiation sessions. That was important because it was targeting the exact location of where I had surgery. And they removed it. I had a lumpectomy. And I just went back recently in July, at the end of July, and I was told that I'm completely in remission, 100%. With nothing, and I have to go back for the next 5 years, every 6 months, with a plan of tamoxifen for the next 5 years.
I can't tell you how many times I've seen patients before where I think they didn't listen to their body because they thought, all right, my doctor is saying this is fine, and I don't need to do another breast scan for another year or so. I'm overthinking it. And then they go back 6 months later and they actually do get diagnosed with a breast cancer. So it's so important to, yes, doctors are on your side to help you, but sometimes they may not see the whole story. And so if you feel like something isn't right, I would never be shy about going back to your doctor and say, hey, I think we need to look at this again.
And in Laura's case, as you said in the beginning, you had your mammogram. You were 4 or 5 months from your next mammogram. And so this happened right in the middle. And so had you not advocated for yourself and gone to your OBGYN it would have potentially been a different stage, right?
Correct.
A different
Yes.
scenario.
A word about fertility preservation. I get this question a lot. I think sometimes patients, especially if they're newly diagnosed with a cancer that they associate in their mind with hormones like breast cancer and estrogen, they're actually afraid to pursue fertility preservation, even though they might want to, because they're afraid that, you know, it might affect their survivability from the cancer or their long-term like mortality rates. And what I always tell patients is I would never advocate just plunging into fertility preservation without the advice of your oncologist.
That's a good point.
But understand that your reproductive endocrinologist, whom you would see for fertility preservation, is going to work in collaboration with your oncologist to figure out, is it appropriate to offer you fertility preservation? I'd say 9 times out of 10, 9.5 times out of 10, whenever I ask the oncologist, they've always said, yes, we have 3 weeks, 4 weeks, 8 weeks for you to work with this patient with this new diagnosis of cancer so that she has the opportunity to try for a family in the future. And there are more and more studies coming out showing that the medicines that you use for egg freezing and embryo freezing, all this fertility preservation, in patients with newly diagnosed cancer do not increase the rate of breast cancer recurrence, do not increase the rate of breast cancer death, mortality. So I try to make sure that patients really have all the information in front of them before they make their final decision.
I know the answer to this question, and you don't have to answer it if you don't want to. But did you have a history of cancer in your family? And does that have anything to do with your own diagnosis?
So ironically enough, 6 years ago, my mom did get breast cancer, stage 1 as well. Different type of cancer, different from mine, but we both had genetic testing and it was negative. So the conclusion that I'm getting from the institution that we both go to now, because we're both patients, is it's environmental. It can be a number of things, what we ingest, what we drink, lifestyles. It can really just be that. It wasn't necessarily family history.
Yep.
It's not anymore.
There are some family histories. Laura and her mom both had genetic tests because there are some genetic causes for cancer.
Right.
Things like BRCA and others.
Yeah, BRCA1, BRCA2, and there's some other ones as well. And so I think the lifetime risk of a woman developing breast cancer is like 1 in 8 individuals. And if you have, for instance, one of these known genetic mutations, it doesn't guarantee you're going to develop breast cancer or ovarian cancer or other cancers associated with that genetic mutation, but it does increase your risk, which is why it's important to know that information if your family shares it with you. And then talk to your doctor, even if you don't have a breast pain scare or a growth scare, so that you can come up with a plan with your doctor about when to start surveillance. Sometimes it may be before the age of 40 to start doing mammograms and MRIs based on your family history and personal history. And it's really good just to be informed as opposed to, unfortunately, being so afraid that you're kind of putting your head in the sand.
Yeah.
Right?
We can link some articles on how to do self-exams, what's normal, and what changes may not be normal, again, so that you can advocate for yourself, talk to your physician, talk to your care team. Any last words from you, Laura, from our survivor?
Know your body. Your body's telling you something. Your body's talking to you by symptoms, by signs, by anything, by touch. It's going to tell you something. Listen to it.
Yep.
Don't ignore it. And I think that's so important.
And I would add to that, get regular, if you're over 40 or if your doctor's told you for another reason you need regular surveillance or mammograms, be sure that you're getting them regularly. Be sure you're having your regular well people checks with a primary care physician. It's really important also to sort of track over time your own health. Anything you would add?
No, and I would also say if you do unfortunately run into getting a diagnosis like what Laura survived, is also just understand that, that there is a bigger picture, and also not just advocate about your current health, but about your future health and your options, which is why I think you need to be able to have this discussion with your oncologist, your care team about fertility preservation as well.
Yeah. So thank you for sharing your story.
Of course.
We love you. And thank you for joining us on this very special DocTalk episode for Breast Cancer Awareness Month in October. Also happens to be our birth month. And as always, if you have specific topics you'd like us to DocTalk about, please drop them in the chat. Let us know, and we love talking to you. Thank you. Thank you, Laura.
Thank you.
Thanks, Laura.
Thank you.